Topic Psychopharmacology. Question number 1. Which one of the following drugs is not correctly paired with its proponents? A. Lithium Joncade. B. Chlorpromazine Delay and Denica. C. Haloperidol Janssen. D. Imipramine Kun. E. Clozapine Bowden. If you look at the options, the antimanic properties of lithium was discovered by Joncade. So A is correctly paired. The antipsychotic effects of chlorpromazine was identified by Delay and Denica. So B is correctly paired. The drug haloperidol was synthesized from pethidine by Janssen. So option C is correctly paired. Kun identified antidepressant properties of imipramine. So option D is also correctly paired. Option E, clozapine Bowden, is incorrectly paired. Kane in the year 1988 rediscovered clozapine in patients who have treatment-resistant schizophrenia. In a multi-center randomized design comparing chlorpromazine versus clozapine in treatment-resistant psychosis, 4% of them showed response to chlorpromazine, while 30% showed response to clozapine. Following this discovery, clozapine was used in the treatment of resistant schizophrenia. For question number 1, the answer is E. Clozapine Bowden is not correctly paired. Question number 2. In schizophrenia, dopamine deficiency is seen in which of the following brain regions? A. Nigrostriatum. B. Mesolimbic pathway. C. Tuberoinfundibular pathway. D. Mesocortical projections. E. All of the above. In patients who have schizophrenia, dopamine deficiency is found in mesocortical regions of the brain. This is responsible for the primary negative symptoms of schizophrenia like anhedonia, apathy, social withdrawal, avolition, etc. Excess dopamine in the mesolimbic region is postulated as a cause of positive symptoms in schizophrenia. But there is deficiency of dopamine in the mesocortical regions, and that is responsible for the negative symptoms. Question number 2, the correct answer is option D. Dopamine deficiency is seen in mesocortical projections in people with schizophrenia. Question number 3, which of the following undergoes metabolism predominantly by first order kinetics? A. Alcohol. B. Phenytoin. C. Venlafaxine XL. D. Depot antipsychotics. E. Thioridazine. Let's see few important points about first order kinetics. Drugs can undergo two different types of clearance. First order kinetics, zero order kinetics. What is first order kinetics? When a constant fraction of drug is cleared per unit time, it is called as first order kinetics. This means that when the amount of drug in plasma or dose of administered drug increases, the clearance also proportionately increases as a stable fraction of plasma concentration. In other words, the higher the amounts of a drug present, then faster is the elimination. For example, say if a drug has a half-life of 2 hours, then the plasma concentration changes as follows. If the total amount of drug is 100 milligrams per ml in 2 hours, then after 2 hours, it will come down to 50 milligrams per ml. Then the next 2 hours, it will come down to 25 milligrams per ml. And in the subsequent 2 hours, it will come down to 12.5 milligrams per ml. So, a constant fraction of a drug is cleared per unit time, and this is called as first order kinetics. Most psychotropic drugs follow first order kinetics. In first order kinetics, The rate depends only on the drug concentration. When represented graphically, first order elimination follows an exponential decay versus time. First order kinetics follows an exponential decay over time. Let's look at zero order kinetics. Here, a constant amount and not a fraction of a drug is cleared per unit time. If the total amount of drug is 100 milligrams, in 2 hours it comes down to 80 milligrams. The next 2 hours it goes down to 60 milligrams, and then it goes down to 40 milligrams. Here it is a constant amount but not a fraction of drug that is cleared. Irrespective of the amount of drug, only a fixed unit of drug is cleared by the body. As such, increasing the dose might result in serious toxicity in this case. The drugs that follow zero order kinetics include alcohol, phenytoin, lithium MR preparation, depot injections, venlafaxine XL, etc. Like we have seen in the previous slides, most psychotropic medications undergoes metabolism by first order kinetics. The answer for question number 3 is option E. Thyroidazine is a psychotropic drug and it undergoes metabolism by first order kinetics. The remaining options like alcohol, phenytoin, venlafaxine XL and depot antipsychotics, they undergo metabolism predominantly by zero order kinetics. Question number 4. The enhancement of drug effects following the repeated administration of the same dose of a drug is called as A. Tolerance, B. Sensitization, C. Cross tolerance, D. Downregulation, E. Dependence. Let's look at some of the important definitions. Tolerance refers to diminished response of drug effects following repeated administration of the same dose of a drug. For example, alcohol, benzodiazepines, barbiturates. With all these classes of medications, there is diminished response of drug effects following repeated administration of the same dose of a drug. This is called tolerance. What is sensitization? The enhancement of drug effects following repeated administration of the same dose of a drug is called sensitization. In this process, there is enhancement of drug effect. One good example is giving stimulants like amphetamines in animals causes enhancement of amphetamine effect, and that is called sensitization. What is cross tolerance? Decrease in response to one drug due to exposure to another drug is called cross tolerance. This forms the basis for a number of drug interactions. For example, if you combine carbamazepine with oral contraceptive pills, then the response to oral contraceptive pills is decreased, or sometimes the oral contraceptive pills may not work at all. It's because there is cross tolerance between carbamazepine and oral contraceptive pills. This forms the basis for a number of drug interactions. Question number 4. The correct answer is option B, sensitization. The enhancement of drug effect following the repeated administration of the same dose of a drug is called as sensitization. Question number 5. The SSRI with the longest half-life is A. Duloxetine, B. Fluoxetine, C. Citalopram, D. Escitalopram, E. Paroxetine. With fluoxetine, when you take multiple doses of fluoxetine, the half-life of fluoxetine is 4 to 6 days. However, its active metabolite, norfluoxetine, has got a half-life of 7 to 15 days. When the drugs have long half-life, there are two important advantages. Number 1, withdrawal symptoms are less. Number 2, missed doses are not problematic. So with fluoxetine, there is less withdrawal symptoms for patients, and even if they skip 1 or 2 doses, it's not problematic for the patients. Question number 5. The correct answer is option B. Fluoxetine is the SSRI medication with the longest half-life. Question number 6. Which of the following mood stabilizers is not recommended for prophylaxis of bipolar affective disorder? A. Lithium, B. Topiramate, C. Lamotrigine, D. Valproate, E. Carbamazepine. If you wanted to call a drug as a good mood stabilizer, they should fill the 4 important criteria. They should be useful for treatment of acute manic symptoms, treatment of acute depressive symptoms, prevention of manic symptoms, and prevention of depressive symptoms. Lithium is one good drug which has got good mood stabilizing effect. Currently, drugs like lithium, sodium valproate, carbamazepine, and lamotrigine, all these are recommended for prophylaxis of bipolar affective disorder. There are no large trials indicating the usefulness of topiramate in bipolar disorder. The current evidence is sparse and limited. Question number 6. The correct answer is option B. Topiramate is not recommended for prophylaxis of bipolar disorder. Question number 7. In patients receiving lithium therapy, the following can be observed even in normal therapeutic doses. A. Fine tremors, B. Ataxia, C. Pulmonary edema, D. ECG changes, E. Bradycardia. Fine tremors are reported in 50% of patients treated on lithium. The other symptoms which are commonly seen are polyuria, polydipsia, and gastric effects. Question number 7. The correct answer is option A. Fine tremors can be observed even in normal therapeutic doses of lithium. Coarse tremors are seen in lithium toxicity. Coarse tremors involves large group of muscle fibers contracting slowly. That's seen in lithium toxicity. ECG changes like flat T waves and inverted T waves are also seen in patients taking lithium therapy. However, fine tremors are much more common than ECG changes. Therefore, the correct answer for question number 7 is option A. Question number 8. The commonest side effect of methylphenidate is A. Insomnia, B. Tics, C. Psychosis, D. Diarrhea, E. Headaches. Methylphenidate is a stimulant. It's an indirect sympathomimetic that increases release of dopamine and noradrenaline. Usually, it's a first-line treatment for attention deficit hyperactivity disorder, and it is also well tolerated. The common side effects of methylphenidate include insomnia, headaches, lack of appetite, therefore leading to weight loss. Tics are reported rarely, or exacerbation of tics are reported rarely. Some may also experience raised blood pressure. Growth suppression may be a long-term outcome of high doses over long periods without drug holidays. The recommended monitoring for children whilst taking methylphenidate include height and weight and also tics. Question number 8. The correct answer is insomnia. Insomnia is the commonest side effect of methylphenidate used for the treatment of ADHD. Question number 9. Which of the following psychotropics is relatively contraindicated when ACE inhibitors are prescribed? A. Lithium, B. Olanzapine, C. Risperidone, D. Sodium valproate, E. Lorazepam. When ACE inhibitors like captopril, enalapril, lisinopril, perindopril, when such medications which belongs to ACE inhibitors are combined with lithium, they can reduce the excretion of lithium and can precipitate lithium toxicity. Use of lithium is relatively contraindicated when ACE inhibitors are prescribed. The other medications which can also interact with lithium and can precipitate toxicity includes loop diuretics. Examples are furosemide and bumetanide. Thiazide diuretics. Examples are bendroflumethiazide, indapamide, chlorthalidone. Non-steroidal inflammatory drugs like ibuprofen. Antidepressants like fluoxetine. antipsychotic medications like haloperidol. All these drugs should not be used concurrently with lithium, and they can precipitate lithium toxicity. Question number 9. The correct answer is option A, lithium. Question number 10. A patient on monoamine oxidase inhibitor can consume A. cheese, B. red wine, C. grapefruit juice, D. broad beans, E. pickled herring. Examples of monoamine oxidase inhibitors include phenelzine, isocarboxazid, and phenylcypromine. Monoamine oxidase inhibitors and tyramine-rich foods interact with each other to cause cheese reaction or tyramine reaction. The features of cheese reaction include nausea, apprehension or anxiety spells, occasional chills, sweating, restlessness, headache in the occipital area, palpitations, and vomiting. Sympathetic overdrive can manifest as piloerection, fever, and dilated pupils. If the reaction is very severe, then cerebral hemorrhage and death can occur to such patients. Treatment for cheese reaction include a drug called phentolamine, which lowers blood pressure in few minutes. Grapefruit juice is not rich in tyramine. All the others like cheese, red wine, broad beans, and pickled herring are rich in tyramine. When they are combined with monoamine oxidase inhibitors, they can cause cheese reaction or tyramine reaction. Question number 10. The correct answer is option C. Grapefruit juice can be consumed because it is not rich in tyramine and therefore it does not cause cheese reaction for patients on monoamine oxidase inhibitors. Question number 11. The most common side effect when using sildenafil is A. headache, B. insomnia, C. bradycardia, D. hypotension, E. double vision. Sildenafil citrate is also called Viagra. It's an indirect vasodilator resulting in headaches for patients taking higher doses of this medication. Sildenafil is used in psychiatric subjects for people who have antipsychotic induced erectile dysfunction. The answer for question number 11 is option A. Headache is a common side effect when using sildenafil. Question number 12. Which of the following is correct with regard to the pharmacokinetics of antipsychotics? A. Plasma level of depot antipsychotics could be as high as 4 times the initial levels 2 to 3 months after starting treatment. B. Adverse effects are usually short-lived than oral medications due to the low frequency of administration. C. Test doses are not useful to avoid severe adverse effects. D. Higher doses are significantly more effective than lower doses. E. Shortening the dosing intervals can improve efficacy in non-responders. With regards to depot antipsychotic medications, steady state plasma levels are reached after 2 to 3 months of treatment. Let's look at some of the salient features of depot injections. All depot medications can be administered safely at their maximum licensed dosing intervals. There is no evidence to suggest that shortening the dose interval improves efficacy. Peak plasma levels are reached only after a long period, which varies from one depot to another. Antipsychotic response is also delayed. Steady state plasma levels are reached only after several weeks or months of continuous therapy, 2 to 3 months in some depot. The observation that some patients deteriorate in the days before the next depot is due is probably fallacious. Moreover, in trials, true relapse seems only to occur 3 to 6 months after withdrawing depot therapy. Also, test doses are usually given in order to prevent any adverse effects while giving depot injections. Question number 12. The correct answer is option A. Plasma level of depot antipsychotics could be as high as 4 times the initial levels, 2 to 3 months after starting the treatment. Question number 13. Which of the following is the precursor of serotonin? A. 5-hydroxytryptamine, B. 5-hydroxytryptophan, C. anandamide, D. 5-hydroxyindolestic acid, E. 5-hydroxydopamine. The precursor or source of serotonin is tryptophan or 5-hydroxytryptophan. 5-hydroxyindolestic acid is the breakdown product of serotonin. Question number 13. The correct answer is option B. 5-hydroxytryptophan is the precursor of serotonin. Question number 14. Which of the following antipsychotic is currently thought to cause least QT prolongation of all antipsychotics? A. haloperidol, B. quetiapine, C. clozapine, D. aripiprazole, E. olanzapine. Antipsychotics block cardiac potassium channels, leading to QTc prolongation. QT prolongation and sudden cardiac deaths have been reported with drugs like droperidol, thioridazine, sertindole, and pimozide. Such medications are not used these days. With regards to QTc prolongation, high effect is seen with haloperidol, pimozide, and sertindole. Moderate effect is seen with chlorpromazine, quetiapine, ziprasidone, and zotapine. There is low effect of QTc prolongation with medications like olanzapine, risperidone, amisulpride, sulpride, clozapine, and flupentixol. There is no effect reported for aripiprazole. Question number 14. The correct answer is option D. Aripiprazole is currently thought to cause least QT prolongation of all antipsychotic medications listed. Question number 15. Which of the following statements is correct with regard to pharmacokinetics? A. Extensive first-pass metabolism increases bioavailability. B. Most orally administered antipsychotics undergo first-pass metabolism. C. First-pass metabolism enables easier entry through blood-brain barrier. D. Chlorpromazine decreases levels of tricyclics. E. Depots achieve peak plasma levels on the third day after injection. Bioavailability refers to how much of an administered drug reaches its target. In other words, the amount of drug that enters systemic circulation. Through IV administration, 100% of drug enters systemic circulation. Therefore, the bioavailability is 100%. But it is not the case with non-parenteral administrations such as oral administration, intramuscular administration, subcutaneous routes, or inhalational routes. The reduction in amount of drug reaching circulation is related to two important factors. One is the degree of absorption. The second one is the effect of first-pass metabolism. Most orally administered drugs undergo first-pass metabolism. Metabolism undergone by an orally absorbed drug during its passage from hepatic portal system through the liver before entering into the systemic circulation. With oral medications, higher doses are generally needed as compared to intramuscular administration. For example, with regards to haloperidol, we have to administer higher doses of haloperidol if you're giving it orally as compared to intramuscular administration. Drugs also undergo phase 1 metabolism and phase 2 metabolism. Phase 1 metabolism involves reactions like oxidation, reduction, and hydrolysis, as a result of which a molecule suitable for conjugation is produced. In phase 2 metabolism, conjugation reactions like glucuronidation occur as a result of which polar compounds that are excretable in bile or urine are formed. It is not essential that a drug must undergo phase 1 metabolism in order to undergo phase 2 metabolism. Some of them undergo direct phase 2 reactions. For example, drugs like lorazepam, temazepam, and oxazepam undergo direct phase 2 reactions. Question number 15. The correct answer is option B. Most orally administered antipsychotic medication undergo first-pass metabolism. If you look at option A, extensive first-pass metabolism increases bioavailability. That is false. If the drug undergoes extensive first-pass metabolism, then it serves to reduce the bioavailability. If you look at option 3, first-pass metabolism does not influence passage through blood-brain barrier. This option is also false. The correct answer for question number 15 is option B. Question number 16. Which of the following is true with regard to acetylcholine? A. Acetylcholinergic projections are more predominant than serotonergic projections in the cortex. B. Acetylcholine is synthesized by acetylcholinesterase. C. Antidementia drugs reduce acetylcholine concentration. D. Tricyclics increase acetylcholine levels. E. Acetylcholine agonists are useful in mild to moderate dementia of Alzheimer's type. The distribution of cholinergic innervation in the human cerebral cortex reveals that all layers of the cerebral cortex display a dense cholinergic innervation. So, cholinergic innervations are seen in all layers of the cerebral cortex. Acetylcholine is synthesized by an enzyme called choline acetyltransferase. It is not synthesized by acetylcholinesterase. Acetylcholinesterase inhibitors tend to increase the concentration of acetylcholine, which is associated with learning and memory functions. Question number 16. The correct answer is option A. Acetylcholinergic projections are more predominant than serotonergic projections in the cortex. Option B is wrong because acetylcholine is synthesized by choline acetyltransferase and not acetylcholinesterase. Option C. Antidementia drugs increase acetylcholine concentration and they do not reduce acetylcholine concentration. Question number 17. Which of the following is true with regard to sodium valproate? A. It is excreted unchanged through the kidney. B. It has no significant interactions with other mood stabilizers. C. It increases carbamazepine levels. D. Intravenous preparation is available for acute mania. E. It should not be combined with antidepressants. Sodium valproate appears to inhibit the glucuronidation of carbamazepine. This leads to an increase in plasma levels of carbamazepine. This may be associated with clinically significant dose-related effects of carbamazepine such as ataxia. Question number 17. The answer is option C. Sodium valproate increases carbamazepine levels. So option C is the answer. If you look at option A, lithium is excreted unchanged through the kidneys. Option B, sodium valproate has got significant interactions with other mood stabilizers, particularly lamotrigine. So the true statement is option C. Question number 18. A placebo is identified as A. A dummy preparation of inactive compound. B. A preparation of active compound without a label. C. A preparation with higher than average propensity to cause side effects. D. An active preparation of precursor molecules. E. A compound that is active for an unrelated disorder. A placebo is identified as a dummy preparation of inactive compound. The placebo is any intervention deliberately used for non-specific psychological or psychophysiological treatment effect. The placebo could be pharmacologically active or inert substances, but most commonly the latter. An active placebo has some activity inherently, but not against the treated condition. When a drug administered as placebo produces prominent side effects, it is known as a nocebo. Placebo sag is the term which refers to a decrease in placebo effect with repeated or chronic administration of placebo drugs. The answer for question number 18 is option A. A placebo is identified as a dummy preparation of inactive compound. Question number 19. Which of the following is a predisposing factor for QT prolongation? A. Female gender. B. Hyperkalemia, C. Hypercalcemia, D. Male gender, E. Hypermagnesemia. The physiological risk factors for QTc prolongation includes female gender, extremes of age, stress or shock, physical exertion, electrolyte imbalances like hypokalemia, hypermagnesemia, bradycardia, long QT syndrome, and history of ischemic heart disease and myocardial infarction. These are all physiological risk factors for QTc prolongation. The answer for question number 19 is option A. Female gender is a predisposing factor for QT prolongation. Question number 20. The benzodiazepines with the longest half-life in a young adult is A. Clonazepam, B. Nitrazepam, C. Temazepam, D. Diazepam, E. Alprazolam. Diazepam is a benzodiazepine which has a very long elimination half-life, 20 to 100 hours, with an active metabolite lasting for 36 to 200 hours. As a result, withdrawal symptoms are not very common with diazepam. Benzodiazepines undergo phase 1 metabolism to produce active metabolites. They have longer elimination half-life than the parent compound. This leads to prolonged effects as plasma concentration rises gradually. Patients may also experience hangover effects. It can lead to confusion in susceptible subjects, particularly the elderly. Among the benzodiazepines, diazepam has got the longest half-life. The drugs which have shorter elimination half-life, including hypnotics like zolpidem, zopiclone, zaleplone, and temazepam. All these drugs do not undergo phase 1 metabolism. The answer for question number 20 is option D. Among the benzodiazepines, diazepam has got the longest half-life. Question number 21. Mrs. Ivy Richards is a 76-year-old woman who is due to be started on memantine. Her daughter has some queries about its action and use. Which of the following is not true regarding memantine? A. It is indicated in moderate to severe Alzheimer's dementia. B. It is an antagonist at NMDA receptors. C. It potentiates the effect of acetylcholine at nicotinic receptors. D. It can cause bradycardia as a side effect. E. Its elimination half-life is 60 to 80 hours. Memantine is an NMDA antagonist used in the treatment of moderate to severe Alzheimer's disease. Its half-life is 60 to 80 hours. The common side effects of memantine are hallucinations and confusion. Memantine is not associated with bradycardia. Acetylcholinesterase inhibitors like donepezil, rivastigmine, galantamine can cause bradycardia as a side effect. The answer for question number 21 is D. Memantine does not cause bradycardia as a side effect. Question number 22. Mr. Ivan Stevens is a 32-year-old man with a history of treatment-resistant schizophrenia who will be started on clozapine in the next few weeks. When he attended the clozapine clinic for an information session, he was advised about the effect of smoking on clozapine. Which of the following is most likely to be seen in smokers on clozapine? A. Decreased urge to smoke. B. Decreased serum clozapine levels. C. Increased serum clozapine levels. D. Increased risk of neutropenia. E. Increased risk of paralytic ileus. Smoking stimulates cytochrome P450 1A2 enzyme system which metabolizes clozapine. This results in lower serum levels of clozapine. Cigarette smoking is quite common among schizophrenic patients. It can induce the enzyme cytochrome P450 1A2 and lowers the concentration of drugs metabolized by this enzyme. These drugs include olanzapine, clozapine, etc. This results in lower serum levels of such drugs. Therefore, smokers require higher doses of these drugs than non-smokers. Question number 22. The correct answer is option B. Decreased serum clozapine levels is most likely to be seen in smokers on clozapine. Question number 23. The enzymes that metabolizes most of the body dopamine include A. MAOA, monoamine oxidase A, and COMT, catechol O methyltransferase, B. COMT only, C. MAOB, monoamine oxidase B and COMT, D. MAOA and MAOB, E. MAOA only. The breakdown enzymes of dopamine include monoamine oxidase and catechol O methyltransferase. Among these, MAOA more selectively metabolizes norepinephrine and serotonin. MAOB more selectively metabolizes dopamine. The answer for question number 23 is option C, monoamine oxidase B and catechol O methyltransferase are important enzymes that metabolizes most of the body dopamine. Question number 24. Mrs. Jackson is an 89-year-old lady who has been taking temazepam for many years. Which of the following is correct regarding pharmacokinetics in older people? A. Longer duration of action for fat-soluble drugs. B. Increase in the amount of drug bound to albumin. C. Drugs excreted by the kidney rarely accumulate. D. Dosage reduction is usually not required. E. Drugs are absorbed from the gut more quickly. Let's look into the pharmacokinetics in older adults. Older people have less body water, more body fat, and less albumin than younger adults. This leads to an increased volume of distribution and longer duration of action for some fat-soluble drugs such as benzodiazepines. There is also a reduction in the amount of drug bound to albumin. Renal function declines with age, and therefore drugs excreted by the kidney may require dose reduction or they may accumulate. Gut motility and secretion of gastric acid decrease with age, so drugs are absorbed more slowly. Question number 24. The correct answer is option A. There is longer duration of action for fat-soluble drugs in older people. Other statements from option B to option E is incorrect. Which of the following medications must be used with caution when fluoxamine is prescribed? A. Amlodipine, B. Salbutamol, C. Naproxen, D. Theophylline, E. Paracetamol. The cytochrome P450 enzyme system mediates how the body metabolizes many drugs including antipsychotic medications. The cytochrome P450 enzyme in the gut wall or the liver converts the drugs into a biotransformed product in the bloodstream. After passing through the gut wall and liver, the drug will exist partly as unchanged drug and partly as biotransformed drug. When one drug, for example drug A, inhibits metabolism of the other drug, which is drug B, then the drug A will increase the plasma levels of drug B. When one drug A, induces metabolism of other drug, which is drug B, then the drug A will decrease the plasma levels of drug B. For example, say antipsychotics is an enzyme inhibitor. Antipsychotic medications like chlorpromazine is combined with drug B, which is like a tricyclic antidepressant. Then chlorpromazine will inhibit the tricyclic antidepressant's metabolism and therefore increases the levels of tricyclics. So in this example, drug A is chlorpromazine, drug B is tricyclic antidepressants. Chlorpromazine will inhibit the metabolism of tricyclic antidepressants. Chlorpromazine will increase the plasma levels of tricyclics. When you combine a hepatic microsomal inducer like carbamazepine with tricyclic antidepressant, then carbamazepine can reduce the concentration of tricyclic antidepressants. So when drug A, carbamazepine, induces metabolism of other drug which is a tricyclic antidepressant, then drug A, carbamazepine, will decrease the plasma level of tricyclic antidepressants. We need to know which ones are enzyme inhibitors. The enzyme inhibitors include medications like fluoxamine, fluoxetine, antipsychotics, duloxetine, paroxetine, nefazodone. The enzyme inducers include drugs like carbamazepine, phenobarbital, and phenytoin. In this example, fluoxamine is an enzyme inhibitor. When you combine the drug A, fluoxamine, with theophylline, then it increases the levels of theophylline in the bloodstream. When fluoxamine is prescribed along with theophylline, it increases the peak serum theophylline concentration. It can produce a wide range of adverse reactions, including persistent vomiting and arrhythmias. The answer for 25 is option D, theophylline. Theophylline medication must be used with caution when fluoxamine is prescribed. Question number 26. Placebo effect is not mediated through A, classical conditioning, B, operant conditioning, C, nocebo response, D, expectancy, E, natural remission. What is nocebo response? When a drug administered as placebo produces prominent side effects, it is known as a nocebo, and this response is called nocebo response. Question number 26. The correct answer is nocebo response. Placebo effect is not mediated through nocebo response. Placebo effect is explained through classical conditioning and operant conditioning principles. It is explained through expectancy, where the belief of patient result in selective attention to symptoms improvement and expectations. It is also explained through natural remission, whereby the improvement of symptoms could be just coincidental.